Independent Physicians Association, KIPA, Dr. George Liu, and his team is here as well. Alex, Shirley, and everyone else is around us. And for the last few weeks, they've been very focused on launching these mobile testing sites. And this is not the traditional drive-through sites that we've seen. These are walk-through sites where we have also known as the phone booth-like test sites, where we can actually go where the vulnerable, untested populations are. And many of our immigrants and vulnerable populations, they don't have cars. Many of them are underinsured, unbanked, and they don't have access to testing. So I've been really pushing, as well as elected officials, to push this model forward. South Korea already has so many of these phone booth type of testing everywhere, and they're at a much higher testing rate. I know Congresswoman Grace Meng for the last couple of weeks has been really honing this message in. There is no economic recovery if we don't get our testing up. Not just testing, but also tracing and protecting everyone's privacy while we're doing so, and making sure that people feel comfortable and trusting each other again and coming back to the economy. So I believe this is an amazing model that we should support. And today we're officially launching the Queens site, and I had a chance to we'll take a tour outside to look at it again with elected officials, but they've actually made it even more efficient and incorporated the booth inside the van. So there is you don't even have to go to a phone booth. The phone booth is now retroactively built into the van, and it only takes one or two people to operate that van. And it literally takes, I've seen this in Brooklyn when they did a soft launch, about 3 to 5 minutes to come in, walk through, get a test, and 3 days later, you get the results. We want to scale this up. We've been talking to a couple of funders who want to scale this up because we want to go into the most vulnerable populations and start testing people right away. The details of how we're going to administer this in this week, next couple of weeks, Dr. George Liu will go over in a minute. But let me hand this over to our Congresswoman Grace Meng.
Good afternoon, everyone. I'm Congresswoman Grace Meng, and thank all of you for being here. Thank you to our Assemblyman Ron Kim for all his work on this issue and bringing us together. I'm so thankful for the entire KIPA team, Dr. Liu, and all your team for making sure that the most vulnerable in our communities and in our respective districts have access to testing. This coronavirus pandemic has truly highlighted what most of us knew and many suspected, that there are true healthcare and institutional disparities that make it much harder for so many communities, including immigrant communities and communities of color, from accessing the healthcare that they need. This is exacerbated by the lack of leadership shown in the White House. I have been asking since February, late February, we have had bipartisan meetings with the administration, from the CDC to Dr. Fauci to everyone, Vice President Pence, asking him to please bring more resources for testing into our districts. Now New York and Queens is the heart of the epicenter, and we have gotten minimal help from the White House. So whatever resources we can utilize, and thank you to our media partners for covering today's event, we need to keep the pressure on the White House to make sure that he is helping New York, his hometown of Queens, to make sure that we have access to testing. I also want to acknowledge Ron's work on the issue of nursing homes. We have all seen the horrendous numbers that have come out from nursing homes in our district. They do not have the tools, and the president just said that he would invoke, again, the Defense Production Act to make sure that New York gets resources to be able to test people. People in our nursing homes need to be tested. There are other states and other areas where they are testing all staff, all residents, and that is the best way that we can finally begin to target this problem. So we've been asking for testing since February. I'm thankful that we have this opportunity with the Assemblyman and with KIPA to bring these resources into our community so we can hopefully soon get rid of this coronavirus.
Thank you, Congresswoman. Next, let me bring up State Senator John Liu, please.
Thank you. I'm very happy to join everybody here today. This is an exciting launch, and I join my colleagues in thanking Assemblymember Kim and Kaipa for their leadership in getting this done. I mean, everybody's been saying it, that testing is the number one thing we need now in terms of getting back our economy and getting back to some semblance of normalcy. The president has talked about it. Our governor has talked about it. I'm glad to see, at least initially, that they had a good meeting yesterday, that there will be better, stronger coordination between state and federal government, especially on the issue of testing, how to prepare the tests, how to get the materials for the tests, and ultimately how to conduct these tests, especially in the communities that need it the most, especially in the communities that have been devastated by COVID-19 and continue to be impacted by COVID-19. Dr. Liu and Kaipa and Alex and Peggy Sheng have been and Shirley have been leaders in the community on the medical front, and they continue to do so with this very innovative way to conduct the tests. As Ron mentioned, it can be done by staff who don't even need to leave the van. So this will be safe for the staff who conduct these tests, as well as safe for the people who are being tested. It's all about safety as we take these necessary measures, which include testing. And the testing is of paramount importance. There are many different ways to test now. We have this method that's been pioneered by Dr. Liu and Kaipa. There are many other tests now that, as Governor Cuomo has mentioned a number of times, different kinds of tests are coming online. In fact, I'm happy to report that last week I got my test for COVID-19, and thankfully I'm negative. Hopefully it stays that way, because the problem with some of these diagnostic tests is that they only test retroactively to see if you have gotten it, if you have had it, or you currently have it. But the new tests, the next level of tests that look for the antigens, that will start determining whether somebody, not only whether they had it or have it, but whether they have developed the antibodies to fight the virus and ultimately become immune to it. So we're looking for that as well. That's, again, it is absolutely necessary to have that level of testing in order to get our life back together, in order to get our economy ramped up once again. Thank you, everybody.
Let me bring up our council member, Peter Koo.
Hi, good morning, everyone. Sorry that we meet in these unfortunate times of the pandemic. This virus caused us tremendous losses, not only in health-wise, but also economic-wise. I would say that maybe half of the populations in America have no jobs now. And this is all done by an invisible enemy we have, the virus. So I want to thank Assemblyman Kim and Kaipa and all the elected officials here to support this very important event. Is opening a testing site in our community. Because if we want to open up our economy, we have to first do testing and tracing and isolation, all those things. So without testing, we don't know who has the virus or who doesn't have it. So it's important for us in the community to have a testing site for those who need to be tested, who show symptoms or think they have fever or cough, they suspect they have illness. They can do a test to make sure they're okay, and if they are positive, they can do precautions, isolate themselves, and do contact tracing so that less people will get this horrible disease. So I want to thank Kaipa, Dr. Liu, and his team for doing this, and hopefully we can expand this testing site and make sure the testing technique can be more fast. Now it takes, I think, a few days to get the result. Well, we should borrow techniques from other countries. They know the test within a day. So once again, thank you for everyone for attending this, and hopefully we have a speedy recovery in health and economics also. Thank you very much.
Thank you. Now, last, let's bring up our Dr. George Liu, who spearheaded KIPA's program and successfully launched multiple sites, including in Brooklyn, now today in Queens, and I think in Manhattan as well. Thank you, Dr. George Liu.
Today we're so excited to have the opportunity to present this KIPA started mobile rapid test center system. I think this is one of the most important things for the metropolitan cities, just like New York City. And we know that to actually control the virus, you need 3 major steps. The first step is identification. We have to get all the patients and their contact being examined. In order to do the second step is the isolation. We want all these people who has a disease being quarantined and isolated so they will not infect other people. Then we can go on the prevention mode. And that means to have the people, maybe, which we have almost end, is the shut down the unnecessary system that or the business that so everybody stays home, so let the disease progress slowly and disappear by itself. People was asking me why we want to do this mobile system. And as you know, we have about 4 different type of systems running in New York City. First, if you have a patient, you get sick, what do? First thing is to go to ER, try to get help. And or they say, I call my PCP, I go to his office to see if he can treat me. Or they say, I want to test it, I go to a testing tent in the street corner. Or the fourth way is the drive-in system. All these systems in New York City have the fundamental problems. What is that? When we trying to go to all the system, you go to ER, first, how you get there? You have to take subways, you take a bus, you even have a taxi, a friend drive you down there. What happened? In all the way you go to the public transportation, you infect other people around, or other people in the system infect you, even if you don't have a problem. So this is the system is very dangerous. And if you go to primary care doctor's office, what happened? You know, when you get in there, you have a disease, you may infect the people who sit in the waiting room for other diseases. You infect the staff, you infect the medical assistant, or maybe infect your doctors. And this will kill the first line people in the system. And the third system, by driving a car, hopefully reaching now in New York, drive a car, it's not very common. Number 4, you have a tent. You probably see a lot of tents on the street corner. All those tent systems, they don't have appointment. They go there and wait on the line. Most of my patients told me they wait for 3 hours. When you get down there, they ask a question, and they say, bye-bye, you don't need it. And they die next day. So that happens all the time. So those are the systems we're worried about. So if we have a scheduled mobile system and our own telephone system, tenting system in the community, what we can do that we have scheduled appointment and authorized by the PCPs to avoid all those situations happening. And if you cannot get to the place that we have the car, the ambulance, bring the system to your home site. So everybody can get tested. This will help those people disabled, the people with chronic disease. They cannot take subways or anything. Then they can prevent all the system. And we're so glad that the system we developed, that actually we call them state of art. But it's a very simple, efficient way. It's Ron has been said, there's no contact to the patient. It's completely isolated. So the people being tested and the clinician who do the testing, there's no contact. There's no cross-infection, cross-contamination. So I think it's a great system. It is probably the best system for metropolitan cities because get the car over the place, people cannot do it. And this will really help. One of the most important things, everybody thinks the disease is going downward. But the testing has to be very, very important to be continued. Because if somebody starts to go to work, and then you don't know who's been sick, who's have the germ, then if you don't do it, you have to understand the potential rebound of the disease. In that case, then this will be another very unfortunate second wave of the infection, which will affect the country so badly. So I'm really glad today we have this, all the public elected officials come here to help us, especially Ron Kim has been the fundamental person, support and help us to set the system. And Grace has been also so much helping us, the KAIPA, throughout the years with many programs we have done with the New York communities. And Peter Cruz comes in almost every single time to help us. Yeah. And John Russo, my old friend, has been with us for such a long time. Really appreciate their coming and supporting us. Thank you so much.
Thank you, Dr. George Liu. So just to clarify, for this program, in the interim, it's through referrals from your private physicians who will have to make an appointment with KAIPA to get tested. You could go online directly at www.caipa.net/mobile-testing/. You could just go to the kaipa.net website and get the information as well. Do you have a number, Alex? That people?
Everything is through Test for COVID. We have an email. Test for COVID at kaipa.net.
Test for COVID.
Test number 4
Yep.
for COVID
Yep.
at kaipa.net.
At kaipa.net. Test number 4 for COVID at kaipa.net. And somebody will respond to you. Now, the ultimate goal is to scale this again. We have a proposal to get through 10,000 tests, and we want to go into communities that may not feel comfortable coming out of the shadows, and they're all very important. Again, the main message I think we all have to get around, we are as strong as the weakest link when it comes to COVID-19. Whether you're unbanked, undocumented, it doesn't, we're part of the informal sector, everyone needs to come out and trust the testing process and be part of our economy again. Without everyone getting tested and being healthy, there is no economy, and we believe this is the model that's right, and we can move forward with this. Tony, are there any questions from our online? Okay. All right. So with that, Alan, do you have anything?
Yeah. So the eligibility requirements is that you need a referral from your PCP. Is that correct?
Yes. Yes.
We really need it.
It's eligibility for PCP, but they have to follow the CDC guideline
Okay.
if they fit the criteria for testing.
Okay.
Alex, do you want to come over and explain how the process is?
Oh, okay.
Thank you.
Thank you, Cheryl.
Hi, my name is Alex. I'm the clinical director for KAIPA. What happens is, the process-wise, our PCP would screen the patients. After they screen the patient, they fit the eligibility criteria that is defined by the CDC guideline. Then what happens is they put in a referral through a lab that will well supported by BioReference. And once they fill in the demographic and name of patients, they submit that to our KAIPA SFAX, so it's secure, adhering to the HIPAA guidelines. And from there, our call center will call the patient to schedule an appointment, and whichever site that they fit. For example, if they live in Brooklyn, they should come to our Brooklyn site versus in Queens, right? Once they do that, we'll set the appointment up, and then the day of, they just come by, and all the instructions are in the vehicle listed there, or on our stationary site, everything's listed there. They show their ID to verify, and afterwards, we write their name on the test tube, do the swab, and then they go home. That's all. Very straightforward and simple, and that's pretty much the process.
I mean, you mentioned you have a site in Brooklyn already.
Yes.
How many people have you tested there? I mean, you know.
So at the moment, right now, we're still ramping up. We've probably done about 100 or so at the moment. We just got a bunch of test kits coming up, and we're planning on opening more like 9 to 5 schedule. Right now, we're doing like half days because one, we're training our clinicians too. We recently got another like 7 total. So we want to staff up not only Manhattan, Queens, but also Brooklyn. So we want to be, create more access. Access is important. Safety is very important for us. If I were to prioritize safety, then access. Okay.
Good. All right. I think we're good. I think we're going to go check out the mobile van now. Thank you all.